Is it possible to reverse diabetes? My simple answer is yes. I'll show you how to do it. Hi all, I'm Dr. Ashwin Mugundan, Chief Consultant in Dr. Mohan's Diabetes Specialty Center, Calicut branch. Today I have come up with a very interesting topic. Is it possible to reverse diabetes? I have subdivided this topic into 5 topics altogether. First thing is whether it is possible to reverse diabetes and what do you mean by a reversal of diabetes. Second thing is who all have the best chance to reverse their diabetes. Third thing is what you have to do to reverse your diabetes. Fourth is what are all the options you have to reverse diabetes. Fifth is what are all the long-term benefits and after effects and side effects of reversal of diabetes. So coming to points one by one, is it possible to reverse diabetes? Yes, it is possible. Very recently an international paper have been submitted and published in a very famous journal regarding the reversal of diabetes, which was done in the very large US population. So my talk will be basically based on that study which is published and which has shown good results. Now, what do I mean by reversal? Reversal can be of two types. First thing is you can stop the medications as a whole in a diabetes patient and patient can live medication free without any tablets or insulin. Second thing is reversal is going to a stage earlier, like if the patient is taking insulin, we can switch him to minimal tablets, or if the patient is taking 2, 3, 4, 5 medications for diabetes alone, we can reduce the number of tablets to very minimal, 1 or 2 tablets. Now this is what I meant by reversal. And yes, it is very possible to do this in population, in diabetes patients also. Now coming to the interesting part, which patients is it very easily possible or we should try it? Definitely we should try. First criteria, actually the study was done in mainly the obese population. Obese means the overweight people who have been recently diagnosed with diabetes. The second point is also important, recently diagnosed. It is tough when you have diabetes for the last 20 years and when you are trying to reverse it completely and go into a stage where you need not use any tablets. So that's where the significance. 2 points are, one, ideally the overweight patient who is going into diabetes because of his weight. Second thing is recently detected diabetes. If these two people we get early stages, we can try or we can go for a reversal of diabetes. It is totally possible now. Now coming to what you have to do for reversal of diabetes. This is the most interesting part because as we all know, diabetes is a lifestyle disease. Lifestyle disease means this disease is more common now because our lifestyle have changed. We are eating very unhealthy food. We do not exercise. We do not move around. We have a very sedentary lifestyle. Now coming to the part what we have to do or what was done in the study to reverse diabetes. First of all, the patient's first criteria was to lose around 10 to 15 kgs of their previous weight. This was done very scientifically under medical supervision, not under some fad diet or online diets. Patients were given food supplements in the beginning. Calorie deficient diet was given, around 1000 to 1200 kilocalorie per day was given to the patients, along with the supplementation of micronutrients and macronutrients, essential vitamins and minerals also. The weight loss was maintained over a period of years, actually 1 to 7 years it was maintained, and the patients were followed up. Many of the patients who was successfully maintained, the supplement was given only for few months. After that, the calorie deficient diet was modified to according to the person's choice and the person's cultural background. So the results showed it is possible if the patient maintains the weight loss for years and years. If he can maintain the weight loss, if he can follow the diet regimen strictly, it is possible to live a diabetic drug-free life in a recently diagnosed diabetes or an obese diabetes patient. But the interesting thing found out in the study was lot of people dropped out. Lot of people were not able to maintain the weight loss. They were not motivated enough maybe. And very interesting thing with this paper, when it was recently presented in an international update, one catchy point was there which I found it very funny. It was one quote was written. It was told that you can change a religion religion of a person but not his diet. It's actually true in clinical practice. We talk day in and day out about changing your diet, exercise, everything, but people tend to give it a deaf ear. They don't listen to us properly. Maybe the motivation level goes off after a point of time, but we have to be completely motivated. We have to continue the lifestyle, the healthy lifestyle we are following, then it's totally possible. Now coming to those who don't want to diet at all, like I don't want to do this, I don't want to take this tension. There is one more alternative for obese patients actually. This is called bariatric surgery. Bariatric surgery has brought up revolution in the field of obesity and diabetes, because many patients after bariatric surgery they lost significant weight, and many of the patients were off medications. Without any medications they could live freely without any diabetes also. So second option, alternative option, is a bariatric surgery. Now coming to the long term effects, benefits and side effects. Benefit is obviously you are drug free, you don't have the tension of taking the drug, you don't have the financial stress of buying the drug every time. Then your weight loss is beneficial for your body as a whole also. Now what are all the problems you will face? First thing is it's very difficult to maintain. Very difficult to maintain means 1200 or 1000 kilocalorie diet is not easy to follow for a long term. And bariatric surgery, very few patients or many might like have vitamin deficiencies if not given as a supplement, because the fat absorption will be reduced. It depends on the procedure they are doing. Bariatric surgery, there are different types. It depends on the procedure they are doing, but very commonly we have seen vitamin and mineral deficiencies and certain gastrointestinal issues such as diarrhea or something like that. So my final verdict will be, it is possible to reverse diabetes if you have the willpower to do it. Thank you.